Hey everyone, so today I'm back with another mock USMLE Step 1 and 2 question. So the question is, you have a 55-year-old male, past medical history is notable for high blood pressure and coronary artery disease, for which the patient is status post-stents. Patient comes to the emergency room department today with sudden acute onset of weakness on the right side of his body. He also has slurred speech and difficulty understanding language. What is the most appropriate next step for this patient? The first option is administration of TPA. Option number 2 is non-contrast CT scan of the head. Option 3 is 12-lead EKG. And the last option is CTA of the head and neck. Take a second, read through the question again, pause if needed, and then I'll, in the next slide, go over the answer. So the correct answer for this question is non-contrast CT scan of the head. So in order to answer this question, the first part that you have to answer is, what is the actual diagnosis of this patient? This patient's clinical presentation is very concerning for stroke. With any patient with stroke, the thing that you're looking for is focal motor weakness. And that's often how you distinguish stroke from other sorts of neurological disturbances. Stroke, once again, will have that focal weakness where patients will say have just weakness, a weakness on their left hand or right leg, or you'll see slurred speech, you'll see issues with certain cranial nerves. So that's what you're looking for. Whenever you see these focal neurological deficits, you have to be concerned about stroke. And the reason I say focal deficits is, let's just say someone has generalized weakness where both their upper and lower extremities, everything feels weak. In that situation, it's less like a stroke. It might be more something along the lines of, say, electrolyte abnormalities, which can be causing things. So once again, focal motor weakness, the first thing you should think about is stroke. Now the thing is, if a patient comes to you and you're examining this patient, you're the physician, and the patient does have signs of focal motor weakness, what is the next step that you want to do? The next step, the most important thing, and this is the correct answer, is you want to get a non-contrast CT scan of the head. And the reason you want to do that is you want to have an understanding of whether this patient has ischemic stroke versus hemorrhagic stroke. Now, if the patient has ischemic stroke, then you can give the patient TPA, which can lyse clots in the brain. If the patient has hemorrhagic stroke, then you can't. If the patient has hemorrhagic stroke, you have to call neurosurgery, and they'll figure out what the next steps would be. Once again, patient with ischemic stroke, go ahead and do a non-contrast CT scan of the head, and that will tell you whether there's any signs of a hemorrhage. If there are no signs of hemorrhage, then you can consider possibly giving the patient thrombolytics if they're within the time window. Let's go through the other options really quickly. The first option was administration of TPA. This wouldn't be correct because before you give any patient TPA, you want to rule out any active signs of bleeding, and so you would want to make sure in the situation that the patient doesn't have a hemorrhagic stroke. Third option is 12-lead EKG. I think at some point a patient who comes to the hospital will definitely get EKG, but generally the first step for a stroke patient is you want to get that non-contrast CT scan of the head. The last option is a CT of the head and neck. So CT of the head and neck is very critical to the workup of patient with ischemic stroke. And at some point, patient will get it. And the reason you want to get a CT of the head and neck is you want to assess whether patient has any signs of a large vessel occlusion. But once again, the first step will be getting that non-contrast CT as a scan of the head, and based on that, you can take the next steps. And one thing that's very important to remember is if you get a non-contrast CT scan of the head, and per the radiology read, there's no signs of ischemic stroke, that doesn't mean the patient didn't have a stroke. Often on non-contrast CT scans, signs of stroke can take a very long time to develop. So just because you don't see a sign of stroke on there doesn't mean a patient didn't have a stroke. So the main reason you get the non-contrast CT scan of the head is to make sure there are no signs of hemorrhagic stroke. And that's going to be it for today.